Welcome everybody to the Tripolitan. My name is Rafat Yamak. Today we have a very special guest on the Tripolitan, and we have a kind of unique topic for today. Something that's kind of different than the other topics that we've covered. It deals with speech pathology, special needs, in particular autism. So today we have a special guest, and her name is Samina Sattar. Samina Sattar is a speech language pathologist who graduated with her master's from the University of West Georgia in 2017. Born to immigrant parents from Bangladesh, Samina found her passion working with culturally and linguistically diverse populations. As a speech language pathologist, she works to evaluate, assess, diagnose, and treat children and adults with communication disorders. In grad school, her passions grew from unique opportunities such as participating as a member of the American Speech Hearing Association Minority Student Leadership Program in 2016, and she also went on a student abroad trip to Ecuador, serving language-delayed children and their families in Quito. She spent her clinical fellowship working in a high school of predominantly refugee students from 54 countries, speaking over 47 languages. After practicing as a speech-language pathologist for the past 3 years, she has provided evidence-based intervention for individuals with language disorders, articulation disorders, fluency disorders, voice disorders, feeding and swallowing disorders, autism, and hearing loss. Samina currently works as a pediatric speech-language pathologist with culturally and linguistically diverse children aged from 15 months to 18 years. Samina, welcome to the Tripolitan. Thank you so much for being on today.
Thank you so much for having me, Rafat.
I really appreciate it. There's a lot to cover today, and I'm going to try to make it as focused as possible. Speech pathology is a huge field, and I just kind of wanted to, in the beginning, if you could just introduce the field to the audience. What does speech pathology really consist of? What does it entail? What are the responsibilities and the training involved as well to become a speech pathologist?
Yeah, so, I feel like a lot of people don't know about speech language pathology. The more common term, I guess like the colloquial term for speech language pathologist is speech therapist, or, sometimes people use the term speech teacher. And, I'm okay with responding to both, but I do feel like with that label, it does limit um, the the large amount of things that we do. Our scope of practice is pretty wide. So, as a speech language pathologist, you I remember when I started grad school, they basically said you are going to be a clinician working with patients from birth to death. You can start as early as someone is born, treating them with like a feeding, if they're having feeding difficulties, and then people who are nearing death, whether they're having cognition issues with whether it's Alzheimer's, dementia, brain injuries, and it's a very wide scope because we see all of those ages and we treat a variety of different disorders that are affecting their ability to speak, comprehend, or even swallow or chew food. Um, like for example, what most people know us as is children who either have a stutter. We work on helping them speak more smoothly and fluently. We also work with children who have articulation impairments where they can't pronounce specific sounds, or if there is a pattern of sounds that they continuously miss, which is called phonological process. So that there are so many areas within articulation therapy itself. One of the things I do mostly is language therapy. And that language therapy is basically treating any person that where their ability to comprehend language or express themselves is impaired. It could be one or the other, or it could be both. And there's a lot that goes into that. And it can also be due to a person having a stroke or a brain injury or
Hmm.
autism or even hearing loss or Down syndrome, several other um, uh, diseases or developmental delays can contribute to that. So yeah, go ahead.
No, it's as I was saying, a lot of people they think speech pathology, they think just, people with a stutter or they can't, roll their R's but in reality, it's you guys deal with so many different cases. I wanted to touch upon, obviously, you mentioned Down syndrome and you mentioned autism and kind of these other developmental disorders. What basically, I mean, if I can, I mean, I'm hoping I can phrase this right, but what is the connection between speech pathology and just special needs in general? How do you deal with like a diverse, how do you deal with so many different people coming with different issues, like whether Down syndrome or autism,
Hmm.
and autism itself is a spectrum. How do you deal with each
Hmm.
person? Is it case by case, or how do you go about it?
Yeah, you know, it takes a very multidisciplinary approach when it comes to children with autism or with Down syndrome. Um, I think the best way to develop a treatment plan for these patients is to be able to collaborate with their physician, with a psychologist that may have evaluated them. They may also be receiving other services like physical therapy, occupational therapy, if they, sometimes people with autism or Down syndrome have a hearing impairment. And so it's also great to stay in touch with their audiologist. And if they're school aged, definitely great to stay in touch with their teacher and most importantly, their parents. And so we definitely take that approach by understanding all of the facets that are kind of hindering them from thriving in this environment.
Mhm.
Um,
And does early intervention, I mean, I've read some papers about early intervention when it comes to speech therapy. Is it, and basically most of the people have said that speech early intervention is, going to exponentially improve speech for a child. Is this true based on your experience?
Oh, yes. Oh my gosh, it is definitely true because I have seen, it definitely depends on the child all the time. It depends. It depends on how, some children do very well even if they started late, as long as the parents are very involved in their child's success. But the earlier has always been it's always been the earlier the better. As soon as you can detect something, a concern, a possible delay, it's always best to get that checked out because it makes the progress that much quicker.
Mhm. Okay, yeah, that's what I've been reading. I feel like some parents in the beginning they might kind of be in denial mode, like, no, no, there's no way my kid might have any
Right.
issues, and then ultimately, if they had acted maybe a little bit earlier, uh, the program would have been more efficient, or the treatment
Hmm.
program.
Yeah,
So you said you did grad school, correct, Samina?
right.
So what kind of training were you doing? Was it like kind of field work, hands-on, or classroom, or just
Hmm.
everything basically?
Yeah, it was all of them. So starting grad school, they have the option of doing a 3-year master's if you don't have a bachelor's degree in the field. And then there's a 2-year. So I did the 3-year program, and during the first year, we actually got the opportunity to start working in the university itself had a clinic. So we worked at their clinic where they served children with communication disorders. And we were paired with a clinician, a graduate student clinician who was a little bit more experienced than us, and they kind of mentored us on what it looks like to provide therapy, what it's like to take notes, how to talk to parents, how to evaluate, etc. And on top of that, there were multiple courses we had to take. So we were full-time students throughout most of grad school, and every semester we had some sort of rotation.
Hmm.
So on the first year, we had clinic. That was our rotation, the university clinic. And
Hmm.
then the second year we had a fall, spring, and summer semester where we took courses and we had a different rotation off campus. So the first
Hmm.
semester we actually did a school-based rotation, to experience what it's like working as a speech language pathologist
Hmm.
in a school, whether it's like an elementary, middle, or high school. And then the second rotation was kind of like a mini medical um, externship. So we either worked in like a private practice or a skilled nursing facility or home health or a hospital. And then during the summer, we had an extended medical externship where we would either be like in a hospital, it's like the other places that I mentioned.
Yeah, and I know in the bio um, you mentioned, or actually I did in the introduction. I mentioned the fact that you had went to Ecuador. Did you notice any kind of like cultural stigma that was, prevalent maybe in Ecuador more so than the United States, or more so in the United States compared to Ecuador when it came to speech pathology and the transparency from parents to kind of openly talk about this in a comfortable way?
Yeah, I definitely saw a difference. One of the things I noticed, the area that we were serving, it was a low income area, and I actually noticed a bit of a similarity there, compared to here where I live in Atlanta, where I served also another low income community. But they were not from a different country.
Mhm.
Um, they were all American, and there were some similarities where parents did not know about warning signs of language delays. It was very typical of parents to think, oh, if they're not talking by 2 years, they'll eventually catch up, they'll eventually start speaking. Or if their child has special needs, it is frowned upon. But it is definitely, I did notice that it is more stigmatized in Quito than it was here in the US.
And I guess staying on the same topic, but moving on to a different community, the Muslim community in the United States and even globally. How do you feel like, based on your experience, if you've dealt with any, Muslim clients, American Muslim clients, or just, non-American Muslims, how do you feel, or based on your experience rather, how was it dealing with Muslim clients when it came to speech therapy, and a lot of them that came for speech therapy for kids that might have special needs? Did you feel like it was stigma? Did you feel like they were speaking about it in a way that was kind of, because in our community, it's still, people don't like to talk about these things still openly,
Mhm.
till now. So I just wanted to kind of see what you thought about it, if you've had experience in that regard.
Yeah, it's still not really talked about openly. And I'll tell you, I remember that even it like learning a lot about different types of developmental delays and disorders. I It was very eye-opening for me because I recall a trip I took to Bangladesh when I was younger, and we got to stay at a couple of the villages that my parents used to live at, and they introduced me to some like family members, some distant family members, and they would refer to some of the kids who had special needs as dumb,
Mm.
and I would just look at them and like, they're like, oh yeah, nobody talks to them, they're dumb, so it's basically hopeless. It was really sad for me to see that because I also remembered being an elementary school student, having special needs classmates and seeing that they had like extra assistance. Um, so it was kind of confusing, but also like, when our family kind of explains to us that that's how it is, um, it part of that kind of you kind of carry part of that with you. Um,
Yep.
and as I got older, before I discovered speech pathology, I remember seeing a couple of people with autism, and I didn't know how I could carry a conversation with them. I wanted to, but I just kept thinking, maybe they're not going to understand what I'm saying.
Hmm.
So, I feel like that's definitely prevalent with a lot of community members. I even hear it when I speak to some of my friends today, when I'll talk about hearing loss or I'll talk about autism, and they'll say something like, "Oh, may Allah like heal them or cure them." But the thing is that to them, to these people with autism and hearing loss, they don't look at it as a disease. It's a part of who they are. And so, I my hope and my wish is that it continues to become less, it's continued looked at less as a disability, but more as like a way of life
Yeah.
for people.
I think that's a great point that you're making. And I think especially like, everybody, it's affecting all communities, but especially the Muslim community here in the US. They're starting to realize that this, I read a statistic, I think it's like uh, 1 in every 88 children will have autism or something, or will be on the autism spectrum. So the fact
Yeah.
is, it's becoming really prevalent, and people are starting to have to force to really understand, what's going on here, and that there's a diversity when it comes to people having, certain issues and how to deal with it. Would you have any suggestions regarding, the to the Muslim American community, if you can give any suggestions, especially like the mosques? Um, Sometimes some parents might be a little bit hesitant to bring a child with special needs to the mosque because he may act out, but
Mhm.
maybe the mosque administration or any Islamic institutions in the country can provide some kind of accommodation for these kids. And I just wanted to kind of also get your input on that, having worked in the field, if that's possible, or if that can be accommodated in general.
Yeah, I think one of the main things we should work on is just start having conversations. I don't think families should shy away from speaking to community leaders about how to include their children or their loved ones that have a special need. Because I used to be a part of this organization called MIST. I don't know if you've heard of it.
Hmm.
Um, it stands for Muslim Interscholastic Tournament. And
Okay.
I was on the board of it for about 8 years. And during my time on there, our mission was always to make an environment very inclusive for the Muslim youth. And it was particularly for Muslim high school students, where they got to compete in a variety of different competitions for one weekend. They all came from different high schools in one region. And then once you do well in that region, you can compete in the national tournament. And every year they keep talking about inclusivity. And as I started becoming more well informed about different types of special needs um, and people with disabilities, I just thought about how, like, there really isn't a lot out there for, some people who have special needs and want to feel included, and they want to feel like they're a part of something. And so I feel like it can start with different community organizations where we can ask questions like, how can, and be very specific, like, how can somebody with autism attend this? How can a deaf person attend this? Um,
Yeah.
I have seen like some masajids doing like ASL. I've seen some masajids also do a good job with including people with autism. Actually, the more politically correct way of saying that is autistic. So
Yeah.
I'm gonna stick with that.
Okay.
With for autistic people to volunteer at the masjid, or you can even hire people. So like that's actually something I want to do. I have this dream job of like opening up a cafe and hiring specifically Muslim autistic people or those other people with special needs, because I do know they have the capability and I feel like I have the tools to help them thrive in a work setting.
Yeah, and that's a great dream to have. Even I was, as you're saying, it's starting to pick up a little bit more slowly. I saw this one mosque on their Facebook page. I can't recall which one, but because April is Autism Awareness Month, and they were doing some kind of event, and it was kind of just good to see that finally, Masajid, they're starting to pick up on this more, and the idea that you mentioned about incorporating autistic children, for example, in volunteering, autistic youth, even adults in their volunteer programs. That's just fantastic. And you've seen, even some of these big grocery stores. They've been hiring people like
Hmm.
Kroger, and we have here in Texas a supermarket chain called HEB. They do the same as well. They hire people with special needs. So it's really really good to see that it's starting to become more prevalent. Hiring these kinds of people. Um, I wanted to actually ask you because I'm a little bit curious. Maybe I should have asked you this in the beginning. However, what really inspired you to enter speech pathology? I know you mentioned that you did the 3-year master's program, which for
Hmm.
me, if I was to assume, your bachelor's was in something very different. Is that correct?
Yeah, yeah, it was.
Okay.
Yeah, so I actually didn't know anything about speech language pathology until maybe my second year of undergrad, and I just couldn't figure out what I wanted to do. Um, I I'm the type of person that just really wants to make sure that I'm gonna really love what I do and I'm making some sort of impact. And I one of the reasons why I picked this field is because in one year, I think 2013, speech language pathology was considered like one of the top 10 whitest jobs in America.
Hmm.
And that was really alarming because, like, the populations that they serve, people come from so many different backgrounds, and it makes me question how culturally competent are some of these therapists.
Hmm.
So I wanted to go into the field because I specifically wanted to serve people that looked like me or maybe had culture similar to mine,
Hmm.
which I'm doing now, alhamdulillah, which I'm really thankful for.
It's awesome.
And another reason why I wanted to pursue this is because when I started my bachelor's, I was bouncing around majors like, okay, maybe psychology, maybe education, and then I looked more into education. I was like, maybe I should do special education, but I still felt that to be a bit limiting. And I have so much respect for special educators. I just wanted to do more.
Hmm.
And so I stumbled upon speech language pathology from this. There was this girl that my sister used to nanny for who received speech therapy and occupational therapy. And my sister let me come over once, and I saw that a speech therapist had visited her home, and she told me all about the field, how diverse it is, how you can pick your own hours, you can show up at someone's house, and if you're tired of doing that, you can start your own thing. It's very easy to start your own practice, or you can work in the hospital. And I just thought that was really amazing. And now that I'm out there as a practicing SLP, I'm really excited to just like kind of dip my toes into different settings,
Hmm.
especially and so that I can especially find Muslim families that I can work with, so that they can also be advocates to other Muslims who lack the knowledge, or want to feel some sort of like hope for their loved one with a communication disorder or special need.
Oh, that's great. Honestly, that's a really noble cause, and it's great that you're entering this field with that intention. I think many people will be very happy to hear this. I mean, whoever hears this episode, to hear that there are people, especially our generation coming out there with that kind of outlook, with respect to especially speech pathology. That's fantastic to hear. A lot of times, another thing I want to kind of get your opinion on, a lot of focus is put on the parents, and obviously the parents play a tremendous role when it comes to improving, speech, whether it's their kid has special needs or just even doesn't have special needs, but he's just, has speech issues. But what role do the siblings play in general in helping alleviate some of these speech issues? How can they be of assistance? Any kind of general tips regarding that?
Yeah, I really love hearing when a child that I'm working with has a sibling, and I always try to encourage that, because there are multiple times where I'll see a child and they're too scared to come back to my office, and it's because they think they're in a doctor's office and they think they're
Yeah,
about to get a shot or something. But I'm like, no, we're actually just gonna play,
yeah, yeah.
and they still don't want to. And so to alleviate some of that concern, I always encourage the parent, can you bring their sister or their brother and let them like sit with us? And it's really great to see, like, across the board I have seen almost all siblings, whether they're a younger sibling or an older sibling, play such a supportive role for their sibling who has a special need. And it's really beautiful because I think they have this empathy, like, this is my own, this person like is one of my own people, so I really want to take care of them. And so I tell parents, like, really maximize on that. Like, it's really tiring for you as a parent to do it alone, and you don't have to do it alone. Your daughter, your son also wants to help, and let them help. It helps the person who's also learning to communicate. It helps them feel like, they have support from someone closer to their age, where it doesn't feel like a task. It feels like, they have a friend.
Yeah, absolutely. And I feel like it builds the self-esteem of the person that has that speech issues. I'm sure, I mean, maybe you can expand on this a bit more, but I'm assuming that, people that have some kind of speech issues, they tend to suffer a bit more bullying than, say, a person who has no speech
Hmm.
issues. So I'm guessing that, with you know, positive reinforcement from the siblings, ideally the kid with a speech issue should have more self-esteem in dealing with some of the issues that he might face at school, including bullying.
Yeah, for sure. I've heard a lot of cases of bullying, and the child ending up with anxiety as a result, which definitely doesn't help their ability to communicate.
Yeah, yeah, that's it's I mean, bullying in general is a huge problem here in the U.S., especially in, in some of the public schools. Depends on the district you
Hmm.
live in as well. And I guess that goes back to the whole issue that a lot of times, especially when it comes to some of the, fresh immigrant families that might live in, let's say, disadvantaged neighborhoods, their kids go to school districts that aren't very well funded, basically. So they don't have the resources. The schools don't have the resources to deal with this. And on top of that, you have an environment that may be a bit toxic to somebody that might suffer from this, and it just contributes to a bigger and bigger and bigger problem.
Yeah, that's so true. And that's why it's so important that they get some sort of intervention by a clinician who's very trained to address these concerns. Because I feel like not only are we therapists and clinicians, but we're also counselors. And I think it's really important for us to do our part for those families that are not getting that adequate support.
Yeah, yep. And honestly, Samina, I can't appreciate enough what you're doing. Many people, I think, as I mentioned before, that will listen to this episode will appreciate that there are people out there who could kind of reach out. Do you happen to have, like, if, let's say if somebody wanted to reach out to you, do you happen to have an email that, you can maybe share on this episode or,
Yeah,
uh,
definitely. You can definitely they can email me to my personal account and I'll definitely respond.
okay, okay. Would you mind sharing that,
Yeah.
if you have,
It's Samina, Samina dot Sattar, Sattar at gmail.com.
awesome, awesome. Thank you. And to finally end with the final question, I'm sure there's a lot of, especially Muslims, who are interested in the speech pathology field. Do you have any suggestions for anybody who's entering, especially people who may have kind of similar to your background? Maybe they've done a bachelor's that's not has maybe nothing to do with anything to do with speech pathology, but now that they're interested in getting into it, any kind of general tips, advice to anybody who might be interested in pursuing speech pathology?
Yeah, my advice is to, you know, if you are pursuing it, it can be a difficult road, but it is so worth it, and you will be so appreciated in this field. I think that's one of the advantages that we have is that the work that we do is not only rewarding, but it is appreciated. And I think it's important to feel appreciated in this field because it can be easy to get burned out. And I also say just whatever support you get from people around you, hold on to them because you're going to continuously grow and you're going to keep learning. So always keep an open mind. Um, Keep your mind open to learning more about cultures. And also, not only are you going to be applying these skills in your job, I would definitely challenge those who are pursuing this to um, try to carry over that in their personal life and to keep educating people around you with regards to communication disorders, people with special needs, on how to best include them in the community.
Thank you, Samina. With that beautiful note, we'll end today's episode. I really can't thank you enough. Thank you so much for being on. And we hope to see more of your great work and hopefully also that our paths can cross soon. Thank you so much for being on today.
Thank you so much. Thanks for having me.
Thank you. And for our audience, if you want to follow the Tripolitan, you'll find us on Facebook and Twitter, and you'll find us on Spotify as well, and Google Podcasts, and on YouTube. Feel free to like, share, subscribe, and we hope to see you soon again. Thank you.